We are happy that you joined. Uh, we are going to actually, oh, great. Brenda, did you start the recording?
I did, and I'm stopping the transcription.
Okay, perfect. So thank you all for joining. This session is for specifically students who are pursuing dental hygiene at Wake Tech. We've done some changes for fall 2023 admissions and fall 2024 admissions. So we have these sessions to be able to engage students, answer your questions, and provide clarification on those changes. So to introduce ourselves, my name is Toy Nelson. Some people know me as Toy Griffin. I am the admissions and academic advisor assigned to health sciences programs, but specifically I work on the dental hygiene applications, dental assisting applications, and medical assisting applications. And I will have my co-presenter introduce herself.
I am Brenda Maddox. I'm department head for dental hygiene, and I have been here for about 20 years now. And we're making some adjustments to the admission standards. So we just want Toy to go through those with you, and we'll try to help answer any questions.
Awesome. So again, we thank you all for joining. We will keep the chat feature open. So as we are discussing the changes, feel free to post your questions in the chat. We will answer those questions real time before we actually move forward with the next slide. And answering those questions kind of real time helps us to be able to keep this recording and show it to others that were unable to join today. So let's go ahead and get started. So the agenda for today is we're going to discuss obviously what has changed. We'll talk about the general education requirements, the application period, points for courses completed, general education courses completed, bonus points for 2023, bonus points for 2024, and then any additional points that we would like to add. And if you didn't ask your question during the presentation itself, then we will open the floor for questions at the end to be able to answer questions that you may have, maybe unrelated to the information that we presented today, but you want to ask before we conclude. So for starters, the prerequisites have not changed. There are still 8. On the screen, you'll notice a chart. The area with the darker blue background are all the prerequisites. Those are the course subjects and the course code numbers. And then under each one of those is the course title. So from left to right, there's still a communications required, and that communications course has to have a speaking component. So it doesn't always have to be interpersonal communications or speech, but it does have to be a speaking course. Oftentimes I will, if a student doesn't have that specific course, then I will engage Ms. Maddox to see if we're willing to be able to give you points for that. And then the other courses are English composition, standard college English, humanities or fine art, psychology, sociology. Then there are 3 sciences. That would be chemistry, anatomy and physiology, and then microbiology. What has changed on this slide? Because many of you are probably looking like, okay, they're the same. Who cares? But if you notice, the points have changed. So formally, for the non-sciences courses, the highest you could get is 12 points. The highest you will get for 2023 and beyond is 4A, 3 4B, and 2 4C. And then formally for the sciences, 24 was the highest that you could get for the chemistry and the micro. And the highest now is 8. The highest you could get for the anatomy and physiology formally was 40 points for an A, 34B, 24C, and we've kind of equalized all of the sciences. So you want to pay attention to the point structures. I think it's going to be very difficult when students ask, how competitive is it going to be, because we were using old numbers or the numbers that we formerly used. So it's going to be very hard to predict, like when you're meeting with a student, am I competitive? What should I do because of these changes? So you just kind of have to govern yourself accordingly and do the best that you can. What has not changed is that the sciences are only good for 5 years. So it doesn't matter how great you did in your science 10 years ago, those sciences will not accrue points. They have to be within 5 years of your application deadline. And again, just because a student has completed all the prereqs and you're an outstanding student does not mean that we have to guarantee you a seat. It's always going to be a competitive applicant pool. Lately, we've had over 160 people apply, and we're still only accepting 24. So you want to be very mindful of that. Also, for students who are taking bios outside of Wake Tech, you want to be mindful that bios will transfer into us if they have labs. Any biology without a lab will not be given credit for at Wake Tech. So if you are pursuing this program but taking courses elsewhere, mainly four-year universities, then you want to be careful that you're taking your bios with the lecture in the lab component. So often we do get asked the question on our website, there is this PPG or program planning guide. What it is it is the full curriculum of the program. It's every semester or all the courses that you would take in order to earn the degree. This has to be published legally on every college's website. It does not necessarily mean that the student's going to graduate in the time frame that is sort of published. What this does is it's a very good tool to use once or if you are accepted into the dental hygiene program, because the dental courses as outlined in their appropriate semesters is exactly how they're outlined when you're accepted to the program. What this document doesn't take into consideration is our structure for admitting students. Even though it looks like, oh, I can do the program and still do anatomy and physiology, and I can do English in like my second semester, and I can do chemistry in my summer term, you wouldn't even be able to get into the program without them done first. The structure for admitting is a point system. Those prerequisites or general education courses are your only way into the program. Like, it is a points system. So without taking these courses or assuming that you could take the courses as part of the curriculum, you are not putting yourself in the best position to be a competitive applicant. So in this case, I tell students, don't use this as a tool to self-advise. You meet with an advisor, you find out what courses you need, and create a game plan for completing those courses in a time frame that's suitable for you. And if you're selected, then you use this document as a planner, because it's kind of outlining exactly what you need to do once you are in the program. Ms. Maddox, do you want to add to that?
The other good thing about having those courses done ahead of time is it lightens your load while you're in hygiene. So in your first semester, for example, 5 credit hours of basic anatomy and physiology reduces that load from 17 hours in the semester to 12 in this semester. So it really does help you become more successful in the DEN courses when you have all those courses done and out of the way ahead of time. So it gives you a little bit of an advantage, even though it lengthens out the number of years you're really working at trying to get through the program.
And this is kind of true for all of our health science programs. Is, I don't know of anyone who comes in the door starting a program right away other than probably phlebotomy. Even for nursing, for dental assisting, for even my medical assisting students, they're taking a semester or sometimes a year of courses before they actually start the program. So when you talk about associate's degrees or formally 2-year degrees, nothing really is taking 2 years, especially if you're a health science student. So here we are with changes. Feel free to snap a photo, or you can refer to the packets that we have on the admissions page of the dental hygiene webpage on the school website. There are wonderful packets for 2023 and 2024 that you could actually refer to directly to get this information firsthand. But what we want to highlight is that the application period will begin August 1st this year. So for fall of 22, our application period was April the 1st through January the 31st. January 31st has always been our deadline. However, we just started using application periods, I think it was this year, fall 22, right? Yeah, I think it was. So for this year coming, fall 23, or the next year coming, rather, August the 1st is the earliest that you'll be able to submit an application. You will not find the application on our website as of right now. It's been pulled offline for a purpose. We don't want students submitting them early. So July 31st is when it will come back online. And August the 1st is the first time we will receive an application. So we don't want it July 31st at 11:59 p.m. 12:01 is fine on August the 1st, but just not July 31st. It'll get sent back to you. Another thing to be mindful of is that we are reinstating the shadowing component. So we waived it during the pandemic for obvious reasons, but now we are expecting all of our applicants to complete 20 hours of unpaid job shadowing of a licensed dental hygienist. And please let me emphasize unpaid. We do realize that we have students who work in dental offices. If this becomes a conflict, then do not shadow in your own office of employment. Find somewhere else to do it so that there is a significant difference between your work hours and what you get paid for and volunteer hours of observation. That's extremely important. It has to be verified. We have a form on our website where the application is held that you can download and track your hours, but that form has to be submitted with your application. Without it, we will not accept the application. Just as a note, it is the student's responsibility to find a shadowing site. We are not supplying a list of shadowing locations for students. So that's part of the lesson is you're going out and you're securing this site, you're advocating for yourself, you're locating a dental office or a hygienist. Ooh, where'd the PowerPoint go? There it goes. The hygienist and whatnot, and securing that opportunity. So you want to be sure that you get that done on your own. Any points that you want to mention about this, Brenda?
No, the big thing there is, especially if you work in an office already, is it's different what you do day to day with a, sitting chair side as a dentist, maybe as an assistant or a sterilization tech. We just want to make sure that you're actually observing the hygienist and the ins and outs of everything they do on a day. So that's why we say, even if you're getting paid in an office, most likely you're not getting paid to sit with the hygienist unless you happen to be a hygiene assistant. But we're also trying to just level the playing field so that people that work in an office don't have like an extra advantage that they're getting paid to do the shadowing. So we just request that everything's unpaid for the job shadowing.
Right. Also, obviously, points earned for every general education course earned at the time of the deadline. So what we mean by that is that any courses that you take after the January 31st deadline would not be awarded points. That gets asked often. And it's great that you're taking that course in the spring semester or the summer semester. But once we close January 31st deadline, I am only looking at classes that have been completed as of the fall prior to that January. Anything post the fall would be credited for points the following year. So just be mindful of that. Now, here's the biggie is that we are reinstating bonus points for graduates from a CODA accredited dental assisting program and or a student who is a CDA. Has their certification for dental assisting. And we have some specific criteria for that, and we'll go over the points that we'll award for that one. We are also going to award points for a certificate in or a graduation from another healthcare field. And that's important because we have specific criteria and we have outlined specific job or certifications that are related to this particular area. When there is always a doubt or question about a specific certification or completion, I will always go to Ms. Maddox and refer to her and have her make a decision on whether we will award points for it or not. So for 2023, these are the two bonus point structures that we are introducing for the first time and reintroducing to the point structures. Again, application period for 23 is going to be important. I think the earlier students submit their applications, the smarter they are. I can't tell you what day to submit the application, but certainly you have to pay attention to the details of the program and submit when you feel most comfortable. But we always have points tied. So we have a number of people who have the same points and we can't admit them all. In that case, typically what we're going to do is admit those who submitted their application first. And if students still share the same points or the date of submission, then we start looking at how long a student has been pursuing dental hygiene here at Wake Tech. So that's in that little bottom box there. All right. So regarding bonus points for a certification or graduation from another healthcare field, here are just some examples of occupations and certifications or licensures a student could have. They include nursing, occupational therapists, physical therapists, You have a nursing assistant, massage therapist, chiropractic assistant. The list goes on and on. So what I would have to do, and Mrs. Maddox has posted it in the chat, is there are packets with this information. So you can always refer to the 2023 packet, or if you're planning to apply for 2024, to look at this list. If you do have a question of whether a credential that you've completed would qualify, then you can certainly send an email or schedule an appointment, and an advisor can answer that question for you. So this is what the points will look like for 2023. The highest points that we will award for general education courses will be 44 because the point structures have changed. So it used to be 148, 44 is the highest. And then as far as maximum points are concerned, 4 points is the highest for 2023. And again, we are awarding points for a copy of a diploma or certificate from an ADA CODA accredited dental assisting program, or a copy of your current Dental Assisting National Board certificate. That would be equivalent to 2 points. And then for the healthcare work experience, licensure, certification, or completion, a copy of your transcript, certification, or the license would be necessary to receive the 2 points that we're awarding for that area as well. So if a student had all of these points, the highest they would go is 48. And then if there would be a mix depending upon like A's and B's and whether certification you only had 1 versus having 0. So that's the reason why I wouldn't be able to tell ranges at this point, because we're just reinstating these point structures and using these point structures. So I wouldn't be able to tell you how competitive you are or not. All right, so here we are with changes for 2024. I think this is really important to distinguish between the two, because some of these, or all of them in the red box on the screen, those are specifically for the 2024 point changes. This does not apply to 2023. So if you know that you're not applying for 2023, then you want to probably kind of tune your ears into this information. And this is mainly for those students who are just starting out at Wake Tech, or maybe only have a few prerequisites or general education courses done. You're probably not going to be done with your prereqs or gen eds by 2023's deadline. You're probably not going to be super competitive. So you probably already want to plan ahead, even though it's kind of hard to imagine 2024. I know a lot of people want to apply for 23, but 24 might be better for your situation. And in that case, you may want to talk it through with an advisor, find out how much time you have to be able to get specific courses done. But often I'm advising students to probably take it a little easier and not target 23, maybe 24 would work better. All right, so this is really small print. I don't know why this got so big. I mean, so small, but so I'm going to be kind of reading baby print here. Let me see if I can put it on this other screen I have. Oh, here we go. Perfect.
Toy, there's a quick question here that says,
Yep.
so if you're currently in a prereq class on August 1st, am I still able to apply even though the classes are not complete?
Yeah. So that's different. You know, August 1st means that the course is going to be done by December. So you can submit an application on August the 1st, because I'm not calculating points until after January the 31st. So that's what application period is that it's almost like a Black Friday sale or pre-shopping for Christmas. Like you're getting it early, or you're putting it in early, but you're not necessarily going to open the gift until after Christmas or on Christmas. So it's the same principle, is that you're submitting the application, not because I'm calculating points, because I don't have time to do that right now. I can't legitimately touch any of the applications or start ranking people until the final deadline. So by submitting your application, you're just saying that I want to be considered for 2023, even if you're still taking courses for the summer or for the fall. What I'm suggesting, which you might be confused with, is for those students who are just starting your courses this fall. Let's say you have not taken any college courses, or you have all 3 sciences still left to do, or let's say your sciences are expired and you have to retake them. Unless you plan to take all three of them this fall, I would probably suggest delaying applying to the program till 2024, because you'll be most competitive when you apply, when you know that you have maximized the most points possible as an applicant. You're talking 167 people applying and 24 people accepted. We are turning away more people than we are accepting. And unfortunately, it would be our pleasure to accept more, but we just can't. So hopefully that makes sense. So you can still apply and be in a course. As long as the course ends by December, you will still earn points for the course, but you do not have to have every course done when you submit the application. The purpose of submitting the application early is almost like a letter of intent. I want to be considered for the program, and you can even write on the application that you have courses in progress. I'm always going to check all of your records to make sure I award points for everything that you completed by the deadline. I'm very careful with that. Hopefully that answers your question. All right. So as far as the 2024 points are concerned, and my direction is kind of going to be shifted to my larger screen because the screen is a little bit too small, is we are going to award bonus points scored on the admissions test for dental hygiene. It's for short ATDH, the admissions test for dental hygiene. That is a standardized examination that was created through the American Dental Association. We are not affiliated at all as far as the development of that course, but it's another opportunity to earn bonus points. So when we talk bonus points, these aren't things that you have to do, but these are things that you can consider to be able to be a more competitive applicant. And we'll go over specific details about this on another slide. We are also going to award bonus points for completion of the dental assisting and dental hygiene boot camps. The boot camps are is a program that the dental assisting and dental hygiene departments create twice a year, but hopefully expanding to about 3 times a year. And I'll let Ms. Maddox talk about that. What's the boot camp?
In our boot camp, we tried to tell you the difference between dental assisting and dental hygiene, because one's a licensed profession, one is not. But we also take you through hands-on activities. It's not a lot of sitting around and listening to what we do. We actually have activities set up in our clinics, and you rotate between the dental assisting clinic and a lab that we have and the dental hygiene clinic. And you actually get to do things like take an x-ray or take an impression on a typodont, which is like a mannequin, or put a sealant on a tooth and hold a scaler in your hand. So we rotate you around 8 different stations so that you can actually work on things that we would do in our professions to help give you a little bit better idea about if it's something that you would like to do or not. Kind of the next one down, she's got the DEN 3020 course. It's kind of an expansion course that instead of being a 1-day boot camp that we come in from like 8:30 to about 3:30, 4 o'clock, it's going to be an 8-week course, 2 hours a week to immerse you in the profession a little bit better. So we're going to have you come observe in our clinic. We're going to go over more things about what it's like to be in the program. One of the things that we find is a lot of students think, oh, this is something I really want to do. And then they get into the first few weeks of the program and realize, oh, maybe not. And because we can only take 24 students into the program each year based on our size, we just wanted something that would be able to give you a little bit better indication if you're not real sure if this is what you want to do or not. So we've been working on this 3020 course. We're hopefully going to have it finished up this summer and be able to start offering it again this fall to be some more points that we could earn in the 2024 class. So it's not going to be mandatory, but it's going to be extra in case you're still trying to decide, do I want to do this or do I want to do something else? Or maybe I like assisting versus I like hygiene.
Thank you. Alrighty, so moving on, these are the points. So to kind of recap, all the points you'll be able to earn for 2024. So if you remember back to 23, 44 is the highest that you can earn for general education courses. That remains the same. We haven't changed the point structure for general education courses, but now we've added 2 additional opportunities to earn extra points. So there on the screen, a student would still be able to earn 2 points for a current DANBY certification. That would be your CDA, or a graduate of a CODA accredited dental assisting program, 2 points for that. Then you have a current copy of transcript, a certification license for a healthcare profession. And I didn't emphasize this on the other slide, but it has to be of clinical nature. You have to have patient contact hours. It can't just be working in an office with no patient contact. So that's why if you do feel like you fit the bill you may want to check in to see if we actually will award points for it or not, because it's not necessarily across the board. But 2 points for that as well. And then here are the ones that we're adding for 24. You have successful completion of the boot camp with a copy of the attendance certificate to prove or verify that you did this. That would be 1 point since it's a one-day experience. And then we would award 2 points for the continuing education course. That is a series of opportunities to connect with the dental hygiene department to learn more about the profession and to get more hands-on, face-to-face experiences within the department. Alrighty. The question was asked, if I take the dental hygiene boot camp this year, will it qualify for application on 2024? Yes.
Yeah, we're taking those anywhere up to 3 years in advance of the program. So if you apply for fall of 2024, you could go back as far as 2021 to be able to get it to qualify.
Awesome. Any questions about all the points? So just remember that the boot camp, the continuing education course, and the admissions test for dental assisting are for 2024. These are not point structures that are being applied to 2023. It would have been too soon to introduce these, and it would be a very tight time frame for all students to fairly have the opportunity to maximize these opportunities. So that's why it's kind of being phased in versus just placing it in for this year, especially since August is upon us. We're in May now, and the period for 24 is about to open August the 1st. So I hope that makes sense. All right. So here on the screen is just a little information on the ATDH. Again, it's not a Wake Tech test. You cannot take this test at Wake Tech. We don't have an ability to schedule it. We don't, we have so many students applying, but a little bit about it is that it is optional. These are bonus points. So when it's optional, you can decide whether you want to do it or not. But just from my own personal vantage point, you always want to go above and beyond, especially if you're going against or competing against other students in an applicant pool. So as far as it's concerned, there is a link that's already been posted in the chat where you can find more details on the test, but there is a cost. You have to apply for the exam 60 to 90 days before the exam. There is a fee, $140 as of 2022. We don't know if the cost will increase for 2023. So this is all current real-time information. There are partial fee waivers available in case of severe hardships, and those applications open January the 1st of each year. And you can read those details on that specific website. Currently, the testing periods are March 30th through May 31st, with scores available by July 1st, excuse me. And then the application or testing period September 1st through October 31st, with scores available by December 1. Applicants can only take the ATDH 2 times, 1 regular test and 1 retake per application cycle. So again, you want to print the packets, the admissions packets, and there was a link in the chat provided for 2024 if this particular information applies to you and you're applying for 2024. That way you can have it highlighted and be able to access the information. There was a question in the chat. It says, do you recommend a DA to take boot camp for dental hygiene? And just confirming, attending boot camp will not give us points toward 23 application. That is correct. So the second question, the boot camp will not award points for 23. It will not. It's for 2024. And Brenda, do you want to answer the question about attending the boot camp, a dental assistant attending the boot camp?
Yeah, we're going to kind of change our answer on that a little bit, because in the past we would tell you no. You really already know what an assistant does, and you most likely would know what hygiene does if you're a dental assistant. Now, on the flip side, I understand that if it's earning bonus points, and Toy just said you want to do as much as you possibly can, then yes, I would recommend doing boot camp as well if you can, because it'll just give you an extra couple points toward the admissions process ahead of other people in potential. So yes, it could still be worthwhile too to actually get to do some of the hygiene functions that you can't always do as a dental assistant as well.
Great question. Thank you for the question. So there are points that are going to be awarded for the ATDH. On the screen is an extremely busy slide. But at the top, we're looking at the overall test score will earn you points, and then two sections of the exam, the quantitative reasoning and perceptual ability sections, are going to earn you points as well. The maximum points for the section is 30 points. And I do want to kind of defer to Ms. Maddox again, because if you all think about the grand scheme of things for dental hygiene admissions, we've always looked at grades. And grades don't always equate to a student who will necessarily be strong or successful in the program. So we want to begin introducing opportunities and ways to begin to filter for specific skill sets before we just simply admit a student who is an outstanding academic. There are skills that are needed. Many of you who are dental assistants know this because you've probably observed it in the office. So I want Mrs. Maddox to kind of explain why a test, why this test, and what is this test supposed to identify for us as we evaluate applications.
Yeah, in our courses, when Toy showed you the program planning guide, the PPG, we have 21 classes that are DEN classes in our curriculum. Out of those classes, 5 of them involve hand skills. And we get a lot of very strong students into the program that can handle the didactic courses with no problem, but it's a totally different skill set when you have to put it into action in the clinic. We have a lot of fine motor skills with a lot of really small movements in a very closed space when you look at trying to move an instrument inside the mouth. So what we have been looking at for years is a way to evaluate hand skills before you would get into the program. Because quite honestly, we lose more people out of clinic than we lose out of a didactic course through the program. And as competitive as it is to get in, we'd like to be able to keep as many people as we possibly can to graduate them. And we're just finding that some of the psychomotor skills just aren't there. So this admissions test has come about through the American Dental Association, and they have run the test for the last year or so. We based it, the points are based on the scores that people were earning on the exam. And we decided to focus it on quantitative reasoning for one, because that deals with a lot of the spatial relations as well as perceptual ability. It's going to get at a lot of the hand skills issues that we're seeing in clinic when people lack some of the depth perception, perceptual ability. You now have to be able to look in a mirror, and for a lot of people, it looks like things are backward when you're in the mouth. And some people just can't adjust to that to be able to move the instrument in the right direction. We're really hoping it's going to get at those overall issues we're seeing with some hand skills when people get in. And it's not to say that people can't do it, it just might take them longer. But in our setting, when we only have 24 seats to bring people through, we need to get as many people through the first time around as we can. We do have what we call reentry and restart, where if you fail out of a course, you can come back again. But we also have to work within the limited seats that we have available in the clinic. So again, just trying to find a way to get at the fine tuning of things before we get people into the program.
And I also think another good reason for adding these opportunities is that it doesn't all become about the 8 prerequisite courses or general education courses. I think it allows for other opportunities for students who might not necessarily be able to take a specific course and get that A or get A's in all the courses, but can show strengths in other areas. Do I think it's evening the playing field, or leveling the playing field, I guess is a better word. I just think it's allowing more options and opportunities for more people to be considered for the program in a different way, if that makes sense.
Yeah, great point, Toy.
So there are a couple additional points that we wanted to mention. The first is, and this is a newbie. You want to talk about this, Brenda?
Yeah, in North Carolina, we're a little bit behind the times. In California, they've been allowed to give local anesthesia for over 50 years. We just finally got it approved this year. So dental hygienists can now administer local anesthesia, where in the past we'd have to wait for a dentist to come in to anesthetize our patient, get them numb. to be able to do like a deep scaling. Now dental hygienists are allowed to actually give the anesthesia. So because it's a legally allowable function in North Carolina, we have to teach it in our curriculum. So that's a huge change for people that some people have gone into hygiene because they knew we didn't have to use needles and give injections. Now we can and have to teach it. So just be aware that that's something you're going to need to do when you get into the curriculum.
We're also required to have students have the COVID vaccine. There are off-campus components that you would have to do as a dental hygiene student. And so because of the off-campus sites, we have to kind of follow the guidelines that have been given to us. And some of those sites are requiring the COVID vaccine. This did not happen previously. You want to explain the change, Brenda?
Yeah, it was still optional with our students this last year, but going forward for the class coming in the fall, we had to make it mandatory. We are involved in the community quite a bit. We have a course in our last semester that's a community dental course, as well as we have clinical rotations off campus. And more sites are now requiring that everybody be COVID anesthetized, or immunized. So we had to go back and add that into the requirements to get into the program. It's not really requirements to get in, but once you're in, you have to be immunized or you're not being able to meet our clinical requirements and our community requirements.
And just the final point, and I think everyone's heard me say this, but it never hurts to say it again, but points are calculated at the time the applications are due. So as of January the 31st. So regardless of if you submit the application on August the 1st, I will still calculate points for any course that's completed in the fall 22 semester and for next year, fall 23. Just because you may have applied and you were still taking courses in progress doesn't mean that I would not calculate those points. Again, it's an application period. So when the applications get submitted, they just go to a folder and they kind of sit there and collect dust until it's time for me to start ranking students. When the ranking occurs, I am looking back at every transcript that you've supplied us, whether it's Wake Tech courses or your most current transcript from your transfer institution. And I am awarding points for every course that is complete, and I'm looking for the highest grade for those courses. So I'm always trying to figure out what's going to be best for the student. It's a very fair process. It's a lot of applications, so sometimes there might be a slight oversight, and we do allow students the opportunity to review your points before the admissions decisions are made. We actually encourage students to do appointments right before we release the decisions and send those letters out via email. But just be mindful is that, again, you can submit an application if you feel like, oh, this is my year. I know I'm going to be strong. I'm going to get in. Absolutely submit that application early. If you feel like, oh, I'm not going to be able to complete these courses, or if you're taking any repeats to earn higher points, then maybe fall 24 might be more suitable for you. So if you have difficulty kind of figuring out when is going to be the best timeline for me, or what will be the best timeline for me, on this slide, I provided a link. And I don't know, I can copy the link. How cool is this? Here's the link for making virtual appointments with health sciences advisors. My name is Toy Nelson. If you want to meet with me, if you don't, all of the staff here, advisors, are able to advise for dental hygiene. So it doesn't have to be with me. Sometimes we're all kind of booked, so you can go with the first available. But we also do walk-ins at the Perry Health Sciences campus from 8 a.m. to 5 p.m. Monday through Friday. So if you feel like you're more personable or you like that upfront and personal experience, then you can come in for an appointment as well. So we're opening the floor for questions, if there are any. And I think there were a few.
Yeah, we're going to a question on being vaccinated. Yeah, unfortunately, at this point, we can't say that you can't apply. You can apply and go through the process, but then once accepted, you would have to make the decision to be vaccinated or decline your seat in the program. Because yes, at this point, our community sites are making it mandatory that you have to be vaccinated to be able to rotate there. And without being able to do the rotations, you can't finish the program. So yes, it would end up being mandatory to be vaccinated for the program. see, our next one was, so for the 2023 program, there are no bonus points available. The only bonus points available for 2023 were to be a graduate ACOTA accredited program and have a CDA and if you have any healthcare background experience. Those were the 4 bonus points that you get for 2023.
Right, and please download that packet. The person who asked that question, it's all in the packet so that you can see the different tables for each year. So if you're targeting 23, it's all in print. That way you have it. But there are bonus points for 23. There's a question about application period for dental assisting. Dental assisting, we don't have an application period. It's just a deadline. Your application for assisting has to be in by May 15th. So we are still taking applications for fall of 22 for dental assisting, if you're interested.
I'll grab that next one on the DEN courses from assisting to hygiene. We do have certain classes that transfer between the two, DEN 111 infection and hazard control and DEN 112 dental radiography, normally direct transfer between the 2 programs. DEN 1, you can retake them as well, depending on how long ago you graduated and if the material's still fresh that you'd remember them. DEN 100 is the anatomy course that the assistants take. We take DEN 110, so we can't direct transfer that. So sometimes we'll do a challenge exam in those 2, and students can try to challenge out of the 110 course based on the knowledge they learned in the 100 course. That's really the only 3 that are direct transfer between the 2. Well, 2 are direct transfer and 1 can be challenged. Sometimes we'll look at the dental materials course as well, but we do enough different things between the 2 programs that not all students try to test out of it. So yes, there's a few courses we can look at, but not too many.
Are there other questions? And we will have this recording available for students to kind of review again once it gets edited a little bit. But are there other questions we can answer?
And I don't know if Toy mentioned this, but if anybody wants to take their mic off and talk, that's fine too.
That's fine, yeah.
We will take points for the boot camp attendance for 2024. We're doing boot camp till 2024 and then the 30-20 course in 2024. Anesthesia you have to take while you're in our program. So it's going to be part of our DEN 140 course after you get accepted.
And maybe to go backwards, since 23 is upon us, as a refresh, for 2023, the only things that have changed are the number of points you can earn for your general education courses. And then we have 2 extra point structures. All those other extra points that are outside of these 2 are for 2024. So if we just focus immediately on 2023, it's a copy of your diploma or certificate from an ADA CODA accredited dental assisting program or your current CDA. That's 2 points. And then also we will award for the healthcare education certificate license. And that's 2 points as well. And we have a list of different occupations that would be suitable or fall into a certain category in those packets on the admissions page. So you want to refer to the packet to see if a credential you have or a credential that you're working on would be suitable for earning the 2 points. So it's only 4 points extra for the for 23.
Job shadowing, yes. We usually recommend for people, you might start with the dentist that you go to if you have a regular practice that you go to. Ask them if it's okay if you come observe their hygienist. If not, people usually start with offices closest to their house and just give them a quick call and just, tell them what you're trying to do. I want to apply to the dental hygiene program. I have to job shadow a hygienist for 20 hours. Is it possible to come shadow your hygienist? And they'll tell you if they have time to do it or will allow you in the office or not. So most people just start calling around area offices right near them. Sometimes if they can't get into their dentist, they'll also ask a family member that may live nearby too and see about their dentist. Is another way to go about it. But most of the time you just call up offices and most of the time somebody will let you come observe. It was a little dicey during the pandemic, but offices are open and back up again. And yes, we do have assistants job shadow as well, just because we want you to see the hygienist viewpoint and what they do day in, day out, as opposed to an assistant who's usually tied up next to the dentist, or, possibly doing sterilization tech, or, there's help in the front desk. There's so many other aspects of it. We just want assistants to also watch the hygienist as well. And kind of like Toy explained earlier, you want to make sure it's an unpaid position on that one.
Right. But for the dental assisting application, we don't require shadowing. If that was possibly the question, is that that's not an admissions requirement for dental assisting, but it is a shadowing. The shadowing is a requirement for dental hygiene. And you want to be sure that you shadow in the application period or the year that you're planning to apply. So if you're applying for 23, now's the time to do it. If you're going to be applying for 2024, you probably want to do it in January, anytime between January and when the application period opens in August, August 1st. So we don't want shadowing from 3 years ago. I was a sucker. I'll admit, I was very flexible on it probably about 3 years ago. But I've been told that we have to kind of lay down the law in terms of expecting the shadowing to be done in the year that you're planning to apply.
What we notice in dentistry is things tend to change quite a bit. So we just don't want it done too far in advance, and then, things change within the profession and you didn't get to see some of the more updated things. The only other suggestion on job shadowing is maybe try not even one office. Sometimes going 20 hours to one office is a little tedious. We sometimes will recommend go to different settings, because the other thing we found out one year is we had a student that job shadowed for 20 hours in the same office. And it was an office that is a general practice that saw a lot of recare patients, which are just, maintaining oral health. She got into our program and found out that you see a lot more blood and, pus and all kinds of different things in the mouth than she realized that you could see, because the office she was in, the patients were so clean. So she ended up dropping out within the first 2 months of the program. So I would recommend, if you can get into, maybe you want to see a pedo office to see what it is like with kids. Maybe you want to get into a regular general practice. If you can get into a perio office, something like that, that'll really get you into the meat of what we do, to be able to experience a little bit of everything. So it does not have to be all in the same office.
Great questions. Are there any others?
I have a question. I just thought I would come off of mute, make it faster. So I am currently doing my shadowing hours. Um, I just wanted to know, because my son is due in about 2 weeks. So if something happens where I have to kind of like stop and then kind of pick up where I left off after, I know I'll probably like, not working, not being able to do not much anything besides being a new mom for a few weeks. So is it okay if I like pick up where I left off, even though I know classes in May 10th, like within a few days?
Yeah, because as long as you're within that application period. So if you're doing it within the year of applying, you're fine if there's a gap between them.
Okay. Okay. I just wanted to make sure. Thank you.
Well, good luck.
Yes.
Thank
Yeah.
you.
Yeah. Congratulations.
Thank you.
Yeah, I think the other thing to be mindful of is that you can't submit the application until the shadowing is complete. So once the shadowing is complete, then you can actually submit the application for the program. So just remember that as well, is that even though the application period opens August the 1st, as part of a completed application are the verified or completed shadowing hours. So when you complete them is when you can submit the application.
Okay. Thank you.
You're welcome. Good question, though. Any other questions? Let me go back to the last slide again. In the chat again is the web link for scheduling a bookings appointment, a virtual appointment with the admissions and academic advisor at Health Science Campus. Or again, you can come to the Health Science Campus Building A, room 102. We are able to see students as walk-ins. It's pretty normal over here now. And if you want to email, I can also put my email address. My responses are a little delayed because we are in the throes of fall and summer registration for 22. So business has been picking up with brand new high school graduates. So the email responses might be a little delayed, where I typically respond right away. So you can email me. And if I don't have the answer to the question, then I have direct line of contact with Mrs. Maddox. I'm not fearful of asking questions when I don't necessarily know the answer, or it's a little complicated or beyond my scope.
So
So
if there were hygiene related questions, I usually try to answer those, but Tori really is our go-to for the admissions process. So definitely, she's great to answer your questions. So just keep asking her if you have any admissions type questions. And then, like I said, anything that's more hygiene related, she'll forward my way.
Mhm. Well, we want to thank you. It's 9:50. We still have some time left, so I'll hang around until 10. But if you need to go, we want to thank all those who joined today. It was a great turnout. We will keep this recording and edit it and put it in a place where if you would like a copy, we can forward it to you. I'll even try to post it in the Blackboard shell where the information sessions are located so that you can go back there if you need it. But these are great questions. We hope that you got some clarification. We know that changes are not always easy to understand, but everybody's also a case-by-case situation. So if you feel like you have an individual question that you could not put in the atmosphere today, then you can always have an appointment or send an email where we can discuss your own personal situation. And everybody's plan is going to be a little different. Not everyone's going to look the same. Some of you already have credits complete. Some of you may have just a few. Some of you already know you may have to delay your start and you're looking at a different year. That's having a conversation, going through advising, giving us really basic details or specific details so that we can help you plan it out. So we really, really look forward to meeting with you. There was another question is, when do the summer courses begin? May 15th?
16th.
16th. May 16th is our first summer term. And then we have a couple of terms in the summer, some starting in later May, some ending in June, some ending in July. So that schedule is up, as well as the fall schedule is up. So you can register for summer and fall both at the same time. They're both open. Awesome. But thank you all again.
Thank you.
You're welcome. Thank you for joining us.